So, good evening, all of you. And today we are going to discuss about the awareness during anesthesia. Myself, Dr. Rahul, and welcome back to Ra Online. So, awareness during anesthesia is a vital topic because it has so many of medical legal issues. Whenever we are putting, mostly awareness is seen during general anesthesia because in regional anesthesia the patient is awake, so hardly awareness is concerned. But when you are putting a case or putting a patient in general anesthesia, so awareness is an important aspect. Second thing is that awareness during anesthesia is a 5 marks question. Monitoring of the awareness during anesthesia like B's and entropy can become in the OSCE. Sometimes some of the exam centers will also put this B's monitoring in the Viva stations, and also during the whenever you are putting hemodynamic monitorings or whenever there will be a station for monitoring in the exam, mostly this B's type of electrode or entropy electrodes or train of 4 electrodes. So this type of electrode they keep in the Viva station. Therefore, B's can be asked in the exam itself. Third thing, in the OSCE, suppose a B's monitor was a diagram or was an image in the OSCE paper, and side by side there are different questions related to the bispectral index monitoring or B's monitoring can be easily asked in the exam. Third thing, B's itself is a question of theory paper. It creates 5 marks. Entropy also is a question of 5 marks. So B's and entropy are the vital part of the awareness during anesthesia, and awareness itself is a question of around 5 to 10 marks. So awareness is an important topic, and besides the theory, practical and OSCE, awareness during anesthesia is an important part to deal with in the daily practical life, because whenever you are putting a GA in a patient, and if the patient is aware of all this, and if the patient is not in a stage of deep anesthesia or in a subsequent or in adequate anesthesia level, the patient can be a example, or the patient can aware anything going inside the OT. So therefore we have to take care of the anesthesia awareness. There are different strategies to prevent awareness during anesthesia, but in some clinical situations we are not able to put adequate anesthesia in the patient and the patient develop an awareness. So let's, without wasting time, let us directly go to the awareness itself. Coming to the definition of awareness. So the definition of awareness means awareness under anesthesia refers to the patient being conscious and aware of their surroundings during a surgery or procedure while undergoing general anesthesia. So this is the definition of awareness. Awareness definition is very much important. Whenever we are putting only general anesthesia and the patient is aware of their surrounding during the surgery or the procedure, it is not only related to surgery, it is also related to the procedure. Suppose you are putting a general anesthesia, you are doing some amount of procedures in cath labs or anything. If the patient is aware, then it is a medical legal issue. So there are two types of awareness we came across. First one is explicit awareness and the second is implicit awareness. What is explicit awareness? This refers to the consciousness recollections of the events either spontaneously or as a result of direct questioning. Suppose the patient can directly spontaneously recalls all the intraoperative events, or the patient is able to tell the intraoperative events when you are asking some questions. At the time is known as explicit awareness, and explicit awareness is very much prime concern, because in this stage the patient is in very light stage of anesthesia and the patient is aware of all the intraoperative events. So therefore expletive anesthesia is very much concerned. Coming to the second type of awareness, that is known as implicit awareness. It refers to his memories exist without conscious recalls, but they can alter patient's behavior after the event. Suppose the patient develops some amount of delirium, suppose the patient develops some amount of psychosis, or the patient agitation's behavior is changed in the postoperative period. It is supposed that the patient is aware in the operation theatre or the operating room. So implicit awareness, in which it is suggested that it's stated that when the patient is able to recall and the patient behavior is changed in the postoperative period, then it is known as implicit awareness. But in case of explicit awareness, the patient can express himself or herself about the intraoperative events, or either spontaneously or by direct questioning. When this type of things happens, it is known as explicit awareness. When the patient behavior is changed in the postoperative period, this is known as implicit awareness. And awareness is very difficult to treat also. It needs proper counseling, and we can also prevent awareness. So this is all about the definition of awareness. There are two types, explicit and implicit.